Welcome everyone to the 46th Annual YWCA Hamilton Women Distinction Nominee Unveiling, presented by ArcelorMittal Dofasco. My name is Bianca Caramento, and I'm happy to be here with all of you today and for our final nominee unveiling event tomorrow, as we introduce to you live the 2022 Women of Distinction Award nominees. Yesterday was a powerful afternoon where we announced 18 nominees across the community leadership category. Honestly, I'm still reeling from that one. There were so many inspiring community champions. But today, we will introduce you to two additional award categories and provide you with the opportunity to hear directly from our nominees in the health recreation category and in the research, science, technology, and trades category. Now, before we kick things off, it's important to state that YWCA Hamilton is located on the traditional territory of the Haudenosaunee and Anishinaabe. This territory is covered by the Upper Canada Treaties, within the lands protected by the Dish with One Spoon Wampum Agreement, and is directly adjacent to the Haldimand Treaty territory. We at YWCA Hamilton respect the long-standing relationships with local Indigenous communities, the Mississaugas of the Credit First Nation, and the Six Nations of the Grand River. As a movement, we are dedicated to advancing opportunities for learning and for education, and are committed to the recommendations of the Truth and Reconciliation Commission's report. I encourage you to recognize and acknowledge the land that you occupy, wherever you may be tuning in from. This is our fourth of 5 nominee unveiling events this week. I don't know about you, but I'm feeling pretty inspired and empowered from the nominee unveiling announcements so far. And tomorrow, you'll have a chance to meet nominees within our final award category, the Young Trailblazer category. If you haven't already, join us tomorrow and register online at ywcahamilton.org. As shared in our previous nominee unveilings, we want you to use the chat box. Let us know how you're feeling, or if you're a nominee, cheer for your fellow nominees. For the nominators in the room, let your nominee know you're here for them. We also encourage you to share today's event using the hashtag WOD Hamilton Halton and tagging YWCA Hamilton on Twitter, Instagram, Facebook, and LinkedIn. Our nominee unveiling events will be recorded, and thanks to our media partners, will be airing on Cable 14 and Your TV Halton. Announcing nominees is an exciting milestone each year for YWCA Hamilton. And although we would have loved to have come together in person, the team at YWCA Hamilton plans to once again bring you a virtual award program unlike any other. The 2022 Women of Distinction Awards Gala will be fully virtual and live produced. That's right, you'll be right there with us in the moment as we announce the 2022 winners and pull them on screen in real time to get the reaction and remarks. In addition to announcing all 2022 award category winners, YWCA Hamilton also plans on doing a little announcing themselves. We hope you'll join us on March 3rd to hear this announcement and be part of a very special evening. Now, to share more with us about the work of YWCA Hamilton and today's award categories, please join me in welcoming YWCA Hamilton's Director of Philanthropy and Communications, Sarah Ernest.
Thank you, Bianca. Thank you so much. Thank you for being here with us all week long as we celebrate the 73 incredible Women of Distinction Award nominees. I'm so excited to be here with all of you today for what is now our 4th day of nominee unveilings. And today is an extra special one as we'll be introducing all of you to this year's nominees across 2 categories. Soon you'll meet 13 powerful women who make up our 2022 nominees in both the health and recreation category and the research, science, technology, trades category. 2 of these women are also running for our Lifetime Achievement Award, which is sponsored by Starboard Homes. The nominees you'll soon meet are women who are taking up space, and rightfully so, in traditionally male-dominated sectors. These are the women who are not only building healthy communities, but are building others up around them. This is work that is so critical, and especially now as we continue to respond to the COVID-19 pandemic. And for our YWCA Hamilton, it isn't our first pandemic. We've responded to the needs of those who needed us most during the global pandemic of 1918. And today we're still here, supporting and advocating for women, families, and communities impacted by the COVID-19 crisis. These past now 2 years are a reminder of our legacy, which is a legacy of resilience, support, and community building. This legacy is also shared with today's nominees who are working tirelessly on the front lines of healthcare and showing up for work in the scientific, technological, and industrial spaces. And their work hasn't stopped. Events like Women of Distinction, where we highlight the work of women, the impact of women, and call on continued investments in the lives of women are more important now than ever. YWCAs across Canada are continuing to push for a feminist economic recovery plan for this country, because we know that we can not fully recover from the impacts of COVID-19 unless we have one. This is a plan that centers the needs of women and gender diverse people, because we know that the pandemic has and continues to have a disproportionate effect on these particular folks. Women have and continue to bear the brunt of responsibility on the front lines of our pandemic response and responsibilities while at home. In Ontario, we're challenging our government to commit to a she recovery and invest in long-term, sustainable, gender-focused upskilling and training to help women access well-paying jobs. Investments in skills development and training will break down barriers to achieve women's economic equality. And we're also advocating for investments in universal, high-quality, affordable childcare and the enactment of standards for decent work conditions to improve labor and employment standards in feminized industries. We at YWCA Hamilton are working hard to advance gender and racial equality in our province. And our nominees, especially within this category, are working hard too. To the nominees in this room, congratulations. You are now part of something bigger. You are part of the YWCA Hamilton movement, a movement that impacts over 10,000 people right here in Hamilton and Halton, and over 330,000 women and girls each year right across Canada. As a nominee, your name now joins the ranks of over 1,700 other women who have come before you. Everyone today tuning in, you're going to meet the women in tech, the women in trades, women who are doctors, engineers, professors, VPs, research chairs, women who overall are community champions. To the nominators who took the time to nominate each of these 13 women, we sincerely thank you. Thank you for acknowledging their achievements and their contributions, for advocating for them, and for simply taking the time. And I don't know about all of you, but I'm ready to hear from these women. So I'm going to throw it back to you, Bianca, and let's announce our nominees.
Thanks, Sarah. I'm definitely ready to hear from our nominees. But first, let me tell you how this is going to go. The plan for today's unveiling is that first, I'll announce the names of our 2022 Health and Recreation Award nominees for Hamilton, then Halton. After this category is announced, I'll announce the names of the 2022 nominees for the Research, Science, Technology, and Trades category. Then we'll move to a formal Q&A session to hear from each and every one of these incredible women. Okay, here we go. Are you ready? Our 5 Hamilton nominees for the Health and Recreation Award, sponsored by Green Benefits Group, are Dawn Bodish, Dr. Carrie Beal, also nominated for a Lifetime Achievement Award, Marcy Mcelveen, Sarah Adjecum, Veronica Sola. And this year, we did not receive any nominations for women in the health and recreation category in Halton, but we know that there are so many women doing this important work in our communities. So for next year's awards, we'll be challenging all of you to ensure that these women get nominated and recognized. Next, the 5 nominees for Hamilton in Research, Science, Technology, and Trades category, which is sponsored by McMaster University, are as follows: Karina Andreata, Deborah Christmas, Deborah is also nominated for a Lifetime Achievement Award. Karen Mossman, Shannon Ty Moscow, and Dr. Zobia Jawed. Congratulations, Hamilton nominees. And now, please join me in welcoming the 3 nominees for Halton in research, science, technology, and trades. They are Jennifer Yonke, Navita Dial, and Susan Kilburn. Congratulations to all of the 2022 nominees in the health recreation category and the research, science, technology, and trades category. You are all now part of YWCA Hamilton's legacy. And thank you again to both of our sponsors for each of these award categories, Green Benefits Group and McMaster University. Okay, this is the part where we get into the Q&A. But before we start, it goes without saying that each and every one of you are here because you've led remarkable lives. For us to hear about each of your journeys, we ask that everyone's answer stay within 1 minute. We could probably talk for hours, but today we have less than 1. And so with that, we're going to start with some introductions. So I'm going to call on each of you to tell us a little bit about yourselves and your focus so we can get to know you before we dive into the deeper questions. So we'll start off with Dawn. Dawn, we'd love to hear a little bit more about you.
Hi, I'm Dr. Dawn Bowdish. I'm a PhD scientist in the Department of Medicine at McMaster University and the Canada Research Chair in Aging and Immunity. I'm also the Executive Director of the Firestone Institute for Respiratory Health. And now that I've used up my entire minute with my credentials, I would just like to say that my research interests have always been in the immune system of older adults and what makes them susceptible to infections and what makes vaccines not work as well. And so I've been active in the COVID pandemic and understanding vaccination success and efficacy in long-term care homes and in immunosuppressed populations, which are disproportionately women.
Fantastic. Thanks so much for joining us today. Carrie, we'd love to hear a little bit more about you and get a sense of your focus.
So I'm Carrie Beal. I'm the lead physician for Shelter Health Network, which is a group of 30 physicians who care for the homeless and marginally housed individuals in Hamilton. We run clinics in various shelters and also do a lot of outreach work. And we have been heavily involved in COVID between vaccinating, swabbing, and being involved with the isolation centers.
I believe it. Thanks so much. Marcy, we'd love to hear a little bit about your story.
Excellent. My name is Marcy Mcelveen. I don't come with a whole bunch of credentials other than my life. I am program coordinator for HamSmart, which is the Hamilton Social Medicine Response Team, and also kind of help oversee the Safer Supply Clinic. My passions, based on my own experience and the experience of many people I love and care for, are homelessness and substance abuse and mental illness.
Fantastic. Thanks for joining us today. Veronica, we'd love to hear a little bit about you and your background.
Hello, everyone. I am Veronica Sola. I was born in Argentina, and I am working as a volunteer here in an organization, in a nonprofit organization that works with Latin American immigrants. It's Fraternity Hispanic Association. In this difficult time of the pandemic, adapting our small organization to being able to do online programs with seniors, a really vulnerable sector in our community, was a great achievement for us. And I am the coordinator of many of the digital programs with them. And our idea was to reduce the isolation, potential depression, and helping them to stay active and connected, especially during this difficult time of the pandemic.
Fantastic. Thanks so much for joining us today. Karina, we'd love to hear a little bit more about you and your focus.
Thanks, Bianca. And I love how you pronounce my last name properly. You must be Italian too. My name is Karina, and I'm the program manager of the Project Management Office and Analytics Department
at St. Joseph's Healthcare Hamilton. I've been working in this position for almost 6 years now, or working with the organization. And through that, I've been able to achieve my passion, which has always been to create meaningful and valuable ways to allow patients to take better control of their health using digital tools and technology. So more than ever, especially over the past 2 years, that realm of work has rapidly expanded and been able to support some small and large scale initiatives that ultimately are going to improve patient outcomes and patient care experience, not just at St. Joe's and within the community. So really fortunate to be leading projects, and we can share that work with other hospital organizations and communities, not just within Ontario, but across Canada. So really excited and honored to be here today.
Thanks so much, Karina. Deborah, we'd love to hear a little bit more about you and your background.
Hi, I'm Deborah Christmas. I have been in the field of high tech for 43 years this year, so a very long time, and very male-dominated field. And part of what I do is to try and change that dynamic. So it's been a decades-long effort to bring more women into technology, which is a very big field. As we all know today, there's not one aspect of our life where technology doesn't underpin it in some way, shape, or form. And when you start looking at, we're 50% of the population, we're only 24% of the industry. So I'm on a mission, and I will never give up this fight to continue. I'm going after girls now, 6 to 16, to get them to enter this field and to ensure that the women in technology stay. I'm an author. Please Stay, How Women in Tech Survive and Thrive. I currently am an executive partner with Gartner Canada. They're the largest research company for IT, for information technology. And unfortunately, the women that are in the field are leaving by 50, almost 60%. We cannot afford, can you imagine spending your life in educating yourself and putting in 10 or 15, 20 years into a career and then leaving? They're not leaving at the beginning, they're leaving in the middle. So I'm going to do my part to change that. And part of that means opening doors and knocking the barriers down and making room for them at the table.
Love that. Deborah, we're definitely going to get a little further into what you raised there about the exit later on. So we're going to circle back on that and dive in. Thanks for sharing it. Karen, we'd love to hear a little bit more about you and your focus.
Hi, everyone. I'm Karen Mossman. I am currently serving as the Vice President for Research at McMaster University, and I'm also Chair of the Board of the McMaster Innovation Park. I've been at McMaster for 21 years. I am a researcher in health sciences. The focus of my research happens to be viruses. So our team was working with colleagues in Toronto and the first to isolate SARS-CoV-2 from patients in Toronto. And so that's now the virus that many of our colleagues across Canada are working on. So we're, very actively involved in trying to find out as much as we can about the virus so that we can help with the pandemic. But, importantly, what I find the most satisfying in the role I'm currently in as Vice President Research and really looking at, we did a very large study to look at the research community at McMaster through COVID, and not surprisingly found that, women, young faculty members were the ones that were hit the hardest in all aspects of their research career and in all aspects. And so it really led to, some really great conversations at the senior leadership table of what changes can we make at the university, and what are some changes that we can make to really help support, not just during a pandemic, but long-term, recognizing that, there are challenges in this profession when you're a young career researcher, and especially a woman. So very, very excited. I think the pandemic was the motivator for that to happen. So for me, that's the silver lining with the pandemic.
Fantastic. Thanks for sharing, Karen. I already know we're going to have a phenomenal conversation today. There's already so much being brought up, and these are just the introductions. So let's keep going. Shannon, we'd love to hear a little bit more about you.
Well, I'm Shannon Tomasco, previous child and youth worker turned electrical apprentice, who's now been able to take those two passions and kind of combine them to be this kind of skilled trades advocate that I guess I call myself. So in my spare time, when I'm not working, I try to just encourage women through presentations or school boards, doing different workshops, just to, encourage people to consider it as an option. If you can see it, you can be it. And I didn't have that when I was younger. So I'm just hoping that I can motivate a few people to consider the skilled trades as an option.
Love that. Thanks, Shannon. Zavia, we'd love to hear a little bit more about your background and your passion.
Thank you. My name is Zobia. I work in McMaster University at the Office of Associate Dean, Research, Innovation, and External Relationship at the Faculty of Engineering. My passion is in the area of water, wastewater systems. I've been working in the industry for the last 15 plus years, and it was an eye-opening time for me to know that I was only one of the female traveling to almost every municipality across Ontario to really support the operators who are responsible for treatment for water and wastewater systems. I had the opportunity to work at McMaster University to build the very initial setup for wastewater testing and track COVID-19 cases at the community level. Obviously, that work has been now expanded. New partnerships and collaborators have come on board, and we were able to create one of the premier centers at McMaster University in collaboration with St. Joe's Hospital. Along with this, I'm very, very passionate about youth empowerment and especially BIPOC women. I come from a visible minority myself and have seen a fair share of barriers as well. So my goal is to ensure that we continue pushing those barriers and start seeing more young women in water and wastewater systems. And one of my key research areas now is to start transforming our wastewater systems into more valuable resource for sustainable circular carbon economy. Thank you.
Love that, Sophia. Thanks so much for sharing. Jennifer, we'd love to hear a little bit more about you.
Hi, thank you. I'm a faculty member at Mohawk College. I am the faculty and coordinator for the Accessible Media Production Graduate Certificate Program and the principal investigator for the Digital Accessibility Research Lab. I am a member of the International Association for Accessibility Professionals, and I sit on the AODA Education Standards Development Committee for post-secondary as well as the K-12 transition. My area of research focuses on digital accessibility and inclusion. We know that the pandemic has highlighted the need for access, not only in our everyday working lives, but in remote areas as well. Disability tends to impact women higher than men, and providing opportunities for access to employment and education is a real priority of ours. Thank you.
Fantastic. Thanks so much, Jennifer. Navita, we'd love to hear a little bit more about you and your passion.
Sure. So my name is Navita, obviously. My passion has always been the intersection of healthcare and technology. So started out in the startup world. I had 2 startups of my own in the wearable devices area, as well as creating these platforms to enable technology to assist with diagnosis in rural and developing countries through work with the World Health Organization. I'm also a researcher and adjunct professor, and currently I lead the medical devices team at Google, where we focus on wearable devices. So my research interests right now are more longitudinal studies. Can we use these wearables to predict health outcomes? Yeah.
That's awesome. Very cool. Thanks, Navita. Last but certainly not least, Susan, we'd love to hear a little bit about you.
Hi, I'm Susan Kilburn, and first thanks to the YWCA for holding this event and to McMaster for nominating me. And one benefit of going last is I was grateful and honored before, and now hearing all of these other introductions, I'm certainly honored to be part of such an impressive group of women. A little bit about myself. I'm Chief Operating Officer of Lightpoint Financial Technology. I also serve as Chair Board of Directors for Burlington Hydro, and I'm part of the Industrial Advisory Committee for the Engineering and Management program at McMaster University. McMaster is also my alma mater. I graduated there from Engineering, Physics, and Management 30 years ago this year, so a little while back. And look forward to the rest of this conversation. A lot of what others have brought up, particularly some of what Deborah brought up, really resonate with me. So look forward to delving into some of these issues.
As we all are, I think. Thanks so much, Susan. And you know what, we're going to jump right back into that topic that Deborah brought up, and we're going to go into it right now. So if you had advice for women who are in or looking to join your sector, what would that be? We're going to kick it off with Deborah.
Well, part of it is hopefully there's enough insight and communication for them to even consider joining. So part of this, filling the pipeline is we've got to get in early. Hence the new book that we're going to write is called Please Join. We're going after young girls, and we thought we would start, maybe at middle school. And we just saw a study a couple of weeks ago that said at 6 years old. Now we all know what 6 years old is. It's grade one. Grade one. This is first grade. That young girls are already saying, I'm not good in math, I'm not good in science, and they would opt out if they could. 6. So that we need to change, because we need to get them to see and where there is opportunity for them. If you think about how technology is so pervasive in our society, okay, we are changing human society. Civilization is being changed by technology. We absolutely have to have women at the table developing these solutions, or imagine what they're going to look like. If we've got only one part of the population, developing solutions, they'll be even more discriminatory than they are now. We're going to have technology making decisions without half the population creating the platform. So there's some real serious challenges with us not being there. But the other fact is it's a phenomenal career. So there's nothing that you can't do. It's one of the most exciting careers to enter. So we need to show young girls in ways that they will see why I should consider this as a career, because very few, even as young children, people think I want to be a doctor, I want to be a lawyer, I want to be a scientist. They think of certain things as those professional careers, but very few people say, I want to be an IT person. I want to be a technologist. It just doesn't come up that way. I want to be an architect. I want to be, an engineer. So we need to start to showcase what career opportunities are available to them. You buy glasses now using technology. You buy jeans. You can change your hairstyle. So all the things that, might be, we have to talk a different language to our young girls. They might be interested in video games, but not the video games that, our boys are interested in. We have to change that up so that they can see what the potential is. And that means they need to have more role models. They need to be exposed to it in school. So there's a lot of things that we can do to change this trajectory, but we got to change it quickly.
Yeah, those are tangible ideas. I think they're exactly the right direction. And your point about starting early, because a lot of women are discounting themselves, or girls are discounting themselves before even getting to that point. That's key. That's absolutely key. Karen, I was hoping you could also jump into this conversation.
Yeah, sure. So, over the years, I've had countless students and postdocs, where at that level, at the undergraduate level, even the graduate level, 50-50 males and females, but almost very, very few. And then when I was growing up, there were no female faculty members. So in biochemistry, where I did my degree, there were no female faculty members. So there were no role models. And even when I, took over as chair of the biochem department, it was the first time there was a female faculty member. And that was 2013, which is shocking. So there are very few role models. And so I will have, even to this day, a lot of female graduate students, even postdocs, say, I love doing what I'm doing, but I also want a family. I also want all of the other things. So they think they need to drop out because they don't see as many role models, especially as you move further up. But I agree with Deborah. It's a great profession. If anything, I think we have more flexibility in the jobs that we do, in part because of technology. So this is where it's so important to have the technology, but it's such a rewarding profession that you can have a family, you can have a career. And so it's showing them that they can break that mold. They might not see it. And this is where I forget whose line it was about, if you see it, you can be it. And I'm a full advocate of that. And I think that is changing. And that's what heartens me when I hear all of these conversations and I see all of these, powerful women. We are now providing collectively that vision where, you know, women coming up can actually see it. But I understand where they're coming from, and you know, that's what inspires me.
Thanks so much, Karen. Shannon, I'd love to hear exactly how what advice you'd give to women who are maybe interested in joining the trades like you did.
Well, I'd love to add to what those two ladies just said, because, you know, I think they both had such great pieces of advice. And I'm one of the people who've been saying recently, we need to start educating young people younger, you know, younger than, you know, high school. That's too late. If you don't consider it an option before you're maybe 10 years old, will you consider it at all? And so I find, you know, when I think back about my childhood, you know, as a woman, I can't tell you how many times I got pajamas or lotion or perfume as a default present, where boys get tools. They might not like it when they're 10. They're not like, what am I going to do with this hammer? But then they turn 17, 18, 19, and they go back to these cool presents. Our presents have far expired, right? So, you know, let's start buying girls, you know, tools, you know, giving them, empowering them when they're younger and letting them know about the options, because the only options I saw as a kid were the ones in front of me: electrical, plumbing. And people often ask, why did I pick electrical? My answer is not exciting. It was lack of education. And if I was educated more, I'd take a look of the list of 140 skilled trades and perhaps find something that I, you know, a little bit more special for me. So definitely younger, and we definitely need to, you know, be a representation and show people that women can fill these roles.
I love that. Thanks for sharing, Shannon. So for our next question, we're going to move to what inspires you to do what you do. And we're going to start off with Marcy.
Okay, so I'll try to keep this as brief as possible, but so a bit of my story that I'm open about is I'm a person with substance use disorder, currently not using substances, and I'm a person with mental health, and to be nominated in the health category, I have a lot of trauma around healthcare and a lot of disdain for health, the systems as it is, but getting to work in and around it and getting to partner with people and getting to be part of people's journeys, right? And sitting at the tables I get to sit at is both humbling and rewarding. I show up every day because for all the times I didn't show up, right? I do this because I'm losing people I love based on policy, based on toxic drug supply, based on lack of understanding and fear, really, is what's taking the lives of people I care about. And even people I don't know, right? And not only taking their lives, but prior to, like, even outside the overdose crisis, people are criminalized and stigmatized and treated horribly based on a single choice, and that's not okay. And the fact that, like, harm reduction work is finally slowly becoming more prevalent and people are slowly becoming more okay with it, for lack of a better term, is what keeps me going. I think we need to be in a world that people aren't dismissed based on a substance, people aren't dismissed based on a diagnosis, that the people going through stuff are the ones dictating how they go through it, instead of just being told this is what you're going to do and this is what's going to make it better. My whole life I was told, take this pill, life will be better. Don't take this pill, life will be better. Here's an apartment, life will be better. And nobody just stuck by me. And I think part of what inspires me is the ability to just stick by people.
Thanks, Marcy. And thank you for opening up and sharing that with us. That was a lot. So thank you. Carrie, we'd love to know about what inspires you to do what you do.
A little more concise and to the point, I suppose. I'm inspired by seeing the need to get things done. I like to get stuff done. So, you know, seeing that the shelter health clients and the staff that support them needed to be protected from COVID basically made me go out and do all the stuff that I do. You know, working on the theory that it is better to seek forgiveness than permission. I just get stuff done.
Love
Gets
it.
me in trouble occasionally and people lecture me sometimes, but you know what? Stuff gets done.
Effectiveness. We love it. Thank you, Carrie. So Vio, we'd really love to know what inspires you to do what you do.
I think it's a combination of what Marcy and Carrie kind of said, but I think our life experiences somewhere plays a huge role. In a short life that I had so far, I had, it's been part of a war. How many of us have been a part of a war or a pandemic or being in areas where there was no accessibility to water or sanitation? I've seen all of it, and I was one of the first girls in my family to ever go to university, and it was amazing when I was doing my undergrad at McMaster University. I was a very young mom. I had my first child in undergrad years, and it's been a long, long journey. And having the first daughter, I really, really opened my eyes because I didn't want her to have a life that I had, where there were lots of barriers. I wanted to make sure that while I'm trying to break these barriers, by the time my daughter gets into university and she's ready to conquer this world, people like myself and others would have an opportunity to break those barriers. So really, really inspired me to continue pushing for clean water, more representation of women in various different fields, and really having an equitable workforce. I think all of those things are truly something that's very close to my heart.
Thanks so much for sharing. Jennifer, we're going to start with you for a new question. We're going to ask you, how have you adapted during the pandemic? You alluded to it before when you were discussing accessibility. We'd love to hear a little more now.
I think the pandemic has that silver lining that it's really spotlighted the need to have accessible content and accessible access. Before, internet access or access to online material might have been a nice to have, but now it's a necessity. And having access for all Canadians is really an important part of that. And so the work that we do is creating content and material and opportunities for people to be able to engage and interact online and in the digital environment. So it includes everything from virtual reality simulations to being able to get your mail through online platforms, being able to have a job interview and apply for jobs online, or being able to attend school in a digital environment. So that's been the biggest change for us, is that we've moved to a fully virtual online classroom environment. And that opens up opportunities for people who may not have otherwise been able to attend the program because of location or because of their disability, to now be able to acquire the information, acquire an education, and in turn acquire a really well-paying job that allows them to work virtually and meet them where they're able to engage.
Great points. And it'll be very interesting to see, I think, which of these changes continue well beyond the pandemic, beyond this time period now. I think a number of the changes that you mentioned may very well carry on beyond. So thanks for sharing that. Karina, how have you adapted during the pandemic?
Yeah, thank you. That's a really great question. Despite it being one of the most challenging times in the community and healthcare specifically, it's also been a really good opportunity to transform how we deliver care, how we can improve care, that thinking about that quadruple aim. So improving patient and provider experiences, improving our return on investment, improving patient outcomes. We went from conducting, just over 5% of all care was completed virtually to and upwards of like 75% of all care being conducted virtually. And now we're, somewhere between 50 and 60%. And that's in between waves as well. So that's change that's being sustained, and thinking about new approaches to clinics. So we developed virtual urgent care at St. Joe's and the Urgent Care Ontario website. So thinking about, how we can approach how we deliver care, improving continuity of care. So we did and set up a discrete data exchange between long-term care and St. Joe's, which is now going to be expanded across the province. So seamlessly integrating information, improving those transitions from one point in someone's journey to another, enabling timely prescriptions. So setting up the ability to electronically sign and deliver prescriptions to the community from the hospital versus before, and a practice that's still widely followed, writing on paper, handing it to the patient. So taking a look and seeing how we can transform and enable better processes. And then data too. So we have all this data now, we're documenting electronically, care is being conducted virtually. How do we use this data to make quick decisions, but also in thinking about the impact of the pandemic, you know, how do we not just make quick decisions, but how do we predict, right? Where we're going, or maybe factors related to why a person did or did not seek care. And then in all of this is making sure, are we providing equitable access to care with all of these new digital and virtual technology? So making sure that still, and it's a new and growing aspect, but making sure that that's an important consideration in all that we do. So it's been really inspiring to see how we've been able to adapt and change. I think having those capabilities, being able to think of new and different solutions is extremely important in supporting those that you're serving and working with. So thanks.
Absolutely. Thanks, Karina. Yeah, I think it's clear to me that throughout this pandemic, necessity really has led to and forced innovation in ways that we never anticipated or expected that will shape things moving forward. Susan, we'd love to hear about your experience with the pandemic and how things have changed for you.
Sure. So a lot of what other people have said has resonated with me. So a couple of things. One is one thing that stuck with me is how quickly we all adjusted to a completely different way of working. So, you know, as you were saying, Bianca, like even take this event. 2 years ago, if you had been told, you know, hey, let's do this online, you know, it probably would have been met with some surprise and some thoughts that that's not really a possibility. And yet here we are, we've all kind of adapted and continued on and lost maybe less than we thought. Although I will say I do look forward to seeing people in person again in the future. But I guess one other thing that I'll just comment on is sort of, you know, a source of inspiration has been how understanding I think most, like you see in the media some of the bad sides, but I've experienced that most people have actually been very understanding of when colleagues or friends or family are going through different challenges related to the pandemic, or maybe have, you know, different levels of fear about it or whatever. And well, locked in my own house, I've actually witnessed almost a renewed sense of community that's been great to see. So that's been a positive that I've experienced through this.
Love that. Thanks for sharing, Susan. I even, when you mentioned that expansion of empathy, I think about the ease at which now we can say things like, for example, listen, I need to maybe shift our meeting. My kid is sick at the moment. I need to tend to my kid. Before, that would be like okay, that sounds like a you problem, not our problem. But now work has allowed us to, in many cases, not all, but in many cases, to allow for that flexibility. And I think that's an expansion of empathy that you just mentioned there. So thank you for that. Veronica, we'd really love to know how you've adapted through the pandemic.
Through the months of the pandemic, I think we all learn how to adapt and how to be resilient with this new reality, no? For our small organization, engaging members of our community, especially members vulnerable as our seniors in online activity, and seeing them learn and become proficient using tools, online tools to stay active, healthy, and connected has been very rewarding. We really enjoy make a difference in our community and especially with them, with this vulnerable sector.
Beautiful. Thanks so much for sharing that. And that is an excellent segue to my next question for Navita about how you spread awareness about the value of physical, mental, spiritual well-being.
Oh gosh. How I spread awareness is truthfully through a couple channels. One is I do try to mentor other young people that are either looking for their like fit in the career with their career, or trying to balance like life and work. And so that's one channel that I try to take on a more like one-to-one approach. Within my own like social circle, that's something that has been super prevalent, especially given the pandemic. So through those conversations, and I would say whenever I'm given the opportunity to speak at like forums like this or any other like conferences, engagements, things like that, it's always kind of the a footnote that shouldn't be a footnote, but it's like, we always talk about all of these accomplishments and great things that everyone's doing, but we don't talk about what it took to get here. And sometimes it means sacrifices on your own well-being. And how do we get ahead of that and not like retrospectively say, well, I shouldn't have run my body into the ground. So that's I think a big topic, and a topic that a lot of high achieving people, sometimes myself included, like just sweep it under the rug, but it is super important to start that conversation.
No doubt about it. Thanks, Navita. Dawn, we'd love to know how you've been promoting wellness in all of its various shapes and forms.
My work has been primarily on promoting good information about vaccines. And so as the pandemic's progressed, we've had increasing evolution of information and misinformation that's sometimes hard to interpret. And people who have specific health questions or have specific concerns have questions that need answering, and it's been hard to find the forums that do that. We've also found that healthcare providers who aren't confident in their knowledge of how the vaccines work, how we test them for safety, how we know about the lack of long-term side effects, aren't able to really counsel their patients very well. And as a result, people are left with questions, and that breeds misinformation. So with the help of my incredible supporters at McMaster University and St. Joe's Hospital, we've made a number of videos, educational sessions, worked with long-term care residents, worked with people who've been targeted by vaccine misinformation, including many of our healthcare workers in long-term care, and just tried to provide good, accessible, easy to understand information so that people can make the right decisions for them and help the people in their communities make the right decisions for them. And my hope is that with knowledge comes power, and with power in this case comes safety.
Love that. Thanks, Dawn. Marcy, how do you spread awareness about physical, mental, spiritual well-being?
I think the biggest way is just show up. I think is like, so many times it's missed, right? That I used to think when I first started that I had to have answers for people, that it's my job to like make sure they know what they need to do or whatever, right? And the biggest thing is I show up and I listen, and I try to hear what the people are saying, and I don't give them answers. I'm just gonna walk with you. Inspiration, I think, is just by living with integrity and standing by your ethics and your beliefs and your values, and walking in a way that shows that, and having hard conversations, and standing up to systems that sometimes oppress people, and joining tables even when it's uncomfortable, and having conversations and challenging systems, and doing it on behalf of people, and inviting those people to do it with you. And so many people ask me, they're like, how do you see success with the people you work with? Like, how do you know if it's working, what you're doing? And I'm like, because people just are smiling in one moment, right? Or they phone, or they reach out, or they just keep showing up. It's not about success for me. It's not about stats. It's not about flow charts. It's literally, I'm just going to stand with you. And I just want to go back 2 seconds to the question about accessibility and that kind of stuff, right? In my demographic, like COVID happened, and yeah, a lot of stuff went virtually, as we heard, right? And people are like, why didn't people access hospital or access stuff, right? I'm like, they couldn't even find a place to go to the bathroom. Carrie will know, like, the conversations we had about, like, everybody's worried about, like, I can't go to the mall and I can't go to the gym, and I'm standing there with people that have nowhere to go to the bathroom. And I think it's just about, it goes back to inspiration and inclusion and all that stuff, is like, I'm going to fight for you to have a place to use the bathroom and a place to sleep. And then we'll work on all the other stuff.
Yeah, really gives perspective, your comments. Thank you for that. I'm going to move to another question. How do you lead by example in your community? We're going to start off with Deborah.
Well, it's involved in many, many ways. So I do a lot of coaching. I do a lot of mentoring. I do a lot of sponsorship. I work with a lot of young women just on their overall career, career planning. They don't have resources available to them to even just sort of figure out what's next, or where can I go? What are the possibilities? So I do a lot of speaking events, and I think this is I got 3 this week. And it's not just for women, it's for women of color as well. You know, when you start looking at technology, we dropped substantially to like 3% in this industry. And we got a lot of workers in this industry. So part of my work with women is also to help them understand the rules of the game that nobody taught them. You know, when I entered this field, it was, 1979. There's a rule book, and it wasn't written by us. And so you get young women that go into an organization. I've always been in the corporate space, in multi-billion-dollar companies. They don't know the rules. They don't have the political savviness to navigate the structures that exist. And so I'm now writing another book called Get Smarter Faster. It's geared at 25 to 35-year-olds. Here's the rules. Here's what the rules are that you need to understand and that you need to navigate. So what I look at is, how do I work with you to help open the doors for you, use my network as best as I can, create opportunities, find jobs, and then how do I help you ensure that you show up in the way that will garner your success? And if someone doesn't tell you, how are you going to do it? So, all the lessons that I've learned in 40 something years, well, now you pay it forward. When you get to be in your 60s, you don't really care as much anymore. You can say whatever you want, because what are you going to do? What are you going to do to me? I'm no longer in ascension mode. So now I can sort of say, yeah, you need to do that. And then the biggest part, to tell you the truth, is to boost their confidence. That what's the worst that could happen if you stand up and fight for yourself? Because that's a real big issue for women across any field, is their confidence to know that they can stand up and fight for what they need, that they can use their voice and they can't be silenced. There's a lot of people trying to silence us. We cannot be silenced. Okay, so that's a big part, is to reassure them they can do it.
Yeah, I think a lot of folks, that resonates a lot with this idea of, asking for what you want and realizing that really the worst thing someone can say is no, right? And at that point, that if that's the worst it can be, is that the worst outcome? Like, does the sky fall if someone says no? So
nope.
Thank you.
And you ask for something else. Okay.
Exactly right. Thanks, Deborah. So Via, we'd really love to know how you have led by example.
And I think I'm going to echo what Deborah said, and at least the last message around silence, being silent is not a solution anymore. So I try my best to be part of many different board of director positions across Hamilton and Halton areas. And one of the key ones that I'm very, very happy about is because media plays a very huge role in our lives. I sit as a diversity and inclusion member for Metroland Media, where I get to talk about very important topics, which probably we never had this opportunity before. So I get to do some monthly columns for them and really talk about issues which are concerning for our citizens here, as well as working directly with youth at a young age. So I sit as a board of director and as a vice president for Healthy Youth Network, and really promoting STEM education for youth, especially in the remote communities where resources are still lacking. So really trying to make sure that every voice is heard, regardless of where you're located within Hamilton or Halton region.
Absolutely. Thank you for that. Evita, how do you lead by example in the community?
I think similar to a lot of the other women, a lot by speaking engagements, a lot through mentorship, and there are a lot I have inherited the Women Entrepreneurial Series through my late partner, who just tried to get women together and who like to help each other and crowdsource information and network and connect. And so I think that in and of itself is creating a forum for not just me, but everybody else that are in a position to offer advice or anything like that to come together. So that's one of the big ones.
Love that. Thank you. Shannon, how do you lead in your community?
Well, I've been very blessed to join the IBEW Hamilton local union, and through that I've had a few opportunities where I've got to represent women, and we are a very small percentage in our hall. I don't know the exact numbers, but I think the largest I've heard is, only 25 women in almost 1,500 member hall. So I've been blessed to, be present in some of these events where Doug Ford or, Monty McNaughton, where they're promoting the skilled trades and, putting all this funding in, to be present and representing, my hall, my community. And what I love most is, YWCA has given me so much. I'm a participant who's, gone through 2 of your pre-apprenticeship programs, and, I've been able to give back now. And I know the importance of, feedback and, these coordinators needing support. And so I, reached out to them and give them advice, or, through the speaking arrangements and different things to try to hopefully encourage the women that are kind of following me to, consider skilled trades, and that they can do this too.
That's incredible. Thanks for sharing that, Shannon. Veronica, how do you lead in your community?
I think that as a woman and an immigrant, I am passionate about helping and supporting women in our community, because I can relate with the problems that women face every day for opportunities, education, and work on equal terms. I don't know, I try to encourage everyone to volunteer with my example, to help people in need, even if for few hours it will make a difference in our community. There are many opportunities in many organizations, and using our energy to help others is good for them, but it's also very rewarding. I think that because everything good that we give to others returns to us in a positive way.
Couldn't agree more, Veronica. Thank you so much for sharing that. Wow, what a lineup of fierce women in our community on our 4th day of nominee unveiling events. Before we go, we would like to remind all of you to tune in today, viewing this program, those of you who are viewing this program on Cable 14, your TV Halton, or live, that you can purchase your ticket for the awards gala on March 3rd. That's where we're going to name our 2022 Women of Distinction winners in each category. Your ticket to the gala includes a delicious dinner from your choice of one of YWCA's local restaurant partners. We have specially curated menus from Rapscallion Rogue Eatery, Radius, Carmen's, The Platter Company, and Fossil. And pro tip, do not wait to get your ticket. Be sure to get in early before the restaurant that you want sells out. Guests to Women of Distinction will also receive a gift box full of local goodies, compliments of YWCA Hamilton and our partners. And you'll have access to watch the award gala unfold live in a viewing room with friends, family, colleagues, or whoever you'd like to watch with. The team at YWCA has also come up with an out-of-town or a live stream ticket option, which folks can purchase to tune in live to cheer for our nominees wherever they may be. This is a great option for nominees with family and friends who are out of town and who want to be part of the action without the dinner and the gifts. The Women of Distinction Awards is YWCA Hamilton's largest fundraising event of the year, and every dollar that is raised directly supports women and gender diverse people across Hamilton and Halton. By joining us on March 3rd, you won't only get inspired, you'll power change in your community. Before we go, don't forget to join us tomorrow for our final nominee unveiling event, where we will announce the 2022 Young Trailblazers. Register for tomorrow's category unveiling and purchase your ticket for March 3rd at ywcahamilton.org. Thank you everyone for tuning in. I hope you have a great day.